Welcome to another episode of Diplomatic Enclave. I'm your host, Umar Khalid Bhatt. In our previous shows, we've interviewed ambassadors, we've interviewed heads of organizations of different countries that are working in Pakistan, that are working in collaboration with the government of Pakistan to improve its standards in different domains. Today is no exception. We are going to talk to the head of delegation of an organization that has been established since 1863, 153 years to be precise, is working currently in 70 different countries all around the world and has a very solid presence in Pakistan, is working in conflict areas and to alleviate the social problems of the people of the country in collaboration with the government of Pakistan. Let me introduce to you my guest. His name is Reto, and you are the head of delegation of the ICRC. Thank you very much, Reto, to have joined us today on our show.
Thank you very much to have me. Assalamu alaikum. It's a pleasure to be here today.
All right, so you know a little bit of Urdu, I can see that.
I can follow very basic discussions. Don't ask me to speak. It would get very, very embarrassing for me and for you.
But at least you understand when people talk in Urdu, don't you?
I can follow, and I think the advantage of having every now and then an English word helps me to kind of, carry myself through very simple content, yes.
All right. Reto, this is not your first time in Pakistan as the head of delegation of the ICRC. You were in previously as well, around 11 years back in Pakistan.
Actually, the first time I set foot on Pakistani soil was back in '99. I was at the time working in Afghanistan, and Pakistan had always served as a host to ICRC's operation towards Afghanistan. Starting from the early 80s, our planes would be based in Peshawar. So whenever we came or left for Afghanistan and to Afghanistan, we would actually transit through Peshawar. I met my wife in the very late 90s in Mazar-e-Sharif in Afghanistan. Being married since many years, of course, also gives me a personal reason to be here. And professionally, I have for the first time worked in Pakistan for Pakistanis during the tragic earthquake, October 2005 in Kashmir, and now have been in my current role for the last almost 3 years.
All right, when we look at your profile, Reto, you've been to Liberia, you've been to Congo, you've been to Afghanistan, to Pakistan. Does the ICRC only send you to areas that are challenging?
Maybe with the exception of Pakistan.
All right.
Let me put it like this. The ICC, of course, has a strong mandate in very complex conflict situations, and I have done a number of missions in challenging environments where a very traditional ICRC was indeed often making the difference, which can be a difference of life or death for people affected by violence. The countries that you mentioned, looking at Liberia, at the time when I was there, 2003, 2004, barely a state, all sorts of worrying factions, a horrible situation for the civilian population, needed an ICRC that was good in direct implementation of simple life-saving programs. If you look at the realities of Pakistan today, this is a country that has a strong government, has a capacity to take care of lots of issues, even in far-flung areas. And the ICRC of the past in Pakistan, particularly the 80s, working towards Afghanistan, with a very traditional mandate, maybe makes less sense than an ICRC that is more sensitive to what is the indigenous capacity, and it is indeed very big, and where are niches where the global knowledge that we have, the expertise that we have, but also the mandate that we have does make sense. I think it's an ICC being able to contribute significantly.
All right, I'll come directly to the indigenous capacity that you said. How many are you, in fact, in the ICRC?
We are now, for the ICC, actually a relatively small team here in Pakistan. We are about 250 staff. Some are here in Islamabad, others in Peshawar. But we do, out of these two destinations, obviously also cover other parts of the country. One of our strengths is to work in partnership, first and foremost, with the Pakistan Red Crescent. It itself has a response capacity coming through more than 500,000 active volunteers living in the very villages where problems occur, where first aid capacity is required, where after or even during a flood, specific skills are needed in order to bring immediate help and relief to the affected population. So I think it is really this working together with indigenous capacity, and obviously also the commitment that Pakistanis have to their own country, to their own people, their understanding of languages, culture, traditions. I think it is really this combination that makes work in Pakistan for the ICRC effective.
All right. When you talk about conflict management, or when you talk about social issues that confront many different countries, you've been there as well. How much of local population do you take in your organization, and what is the criteria when you hire people in your local, as part of your local staff in your organization, so that they can be more effective as far as implementing your different resolutions are concerned?
See, the ICRC obviously is constantly learning and changing over time. We are a learning organization. We try to be intelligent. We actually, for example, have stopped using the word local employees, and we call them resident staff versus I'm part of a mobile workforce. And I think that reflects in a country like Pakistan actually much better than a lot of the expertise that we need in order to be able to make a difference can simply not be brought from outside, but
That's
exists and needs to be mobilized.
That assimilates
inside.
them more in the organization, I feel.
Absolutely, absolutely. You know, the mobile workforce of the ICRC, for example, has a relatively high turnover. I'm a bit of an exception. I stayed for 7 years in a row in Afghanistan, and a lot of people had the impression that was a bit odd, but I think continuity helps. But then normally it is really the resident workforce of the ICRC with increasingly really ownership of programs that provide for a continuity, that provide for a response that is grounded in local realities. We talk nowadays in the ICRC about one workforce. We don't make that distinction as clearly as we used to do it in the past, but in terms of numbers, we are currently among the 260 staff, to be precise, 16 who are mobile and 150 who are resident staff. Pakistanis from all corners of the country with different assets, obviously from a chaiwala all the way up to people who are in charge of entire programs.
You talked in your earlier question about the mandate. What is the mandate that has been given to the ICRC?
In comparison to INGOs, the ICRC actually has a strong mandate that has been given to it by the international community, very similar to the United Nations, in fact. We have a diplomatic status. We are the guardian of international humanitarian law, the so-called Geneva Conventions, very relevant when countries are in international conflicts, as it has also happened, unfortunately, in the 70 years history of Pakistan. It is a mandate that gives us the strongest role to respond and come in an effort to alleviate suffering when two countries are at war. Let's be practical. 1965 or 1971, the conflict on what became Bangladesh. The ICRC was present in Dhaka at a time when tensions were very high, when including the civilian population was finding it very, very difficult to make ends meet, to find medical care. So we started out with a traditional ICRC operation that then, with the end of hostilities and the fall of Dhaka, actually became a very big ICRC operation that predominantly catered to the needs of so-called POWs, prisoners of war. You remember that close to 90,000, both military members and civilians were, for some of them, for a prolonged period of time, 71 until 74, held in initially Bangladeshi camps for POWs, and then obviously in India. So a traditional role of the ICRC is not only to visit all those that are detained, but also to make sure that they don't lose the contact with their loved ones. During those 4 years, the ICRC exchanged a staggering 1.5 million what we call Red Cross messages. Essentially a simple letter that people laugh about today because we all have our mobile telephones, but that of course, in
those
the
times there were
70s,
no mobile
was
phones.
making the difference between not knowing whether your loved one was still alive to knowing that he is actually, alhamdulillah, doing fine, and you can have a regular exchange with him. So this is a traditional role of the ICRC. Now, the international conflicts with Army A of country A facing Army B of country B have become more rare, and more complex, protracted violence is unfortunately what is facing in particular the Muslim world these days. If you look at the Middle East, conflicts are extremely complex, involve a high number of actors. And over time, what the ICRC has observed is that in terms of where the suffering lies, the conflict that in fact created the ICRC, the Battle of Solferino back in 1863, really saw two armies fighting each other in a valley. And you had the civilian population, Italian at the time, actually sitting on the surrounding hills, knowing that after a battle which would last a day, they would probably know who has won, completely unaffected. It took a Swiss businessman, Henri Dunant, to see the suffering on the battlefield, the 10,000s of wounded nobody was taking care of, the dead nobody was trying to kind of give some news to family members, to have the idea of the Red Cross as a neutral, impartial and independent organization coming to the rescue of those needing assistance and protection. And the basic idea is very simple and remains valid until today. It is those no longer taking part in hostilities, so it can indeed be an injured serviceman. It is these people being detained at the end of hostilities, but it is first and foremost the civilian population. And from hardly any civilians being affected by the conflicts 150 years ago, the ratio has actually shifted, and you would today, in an average conflict, insofar as there is such a thing like an average conflict, but nevertheless see often more than 10 times as many civilians being directly affected than members of the warring parties. So the mandate of the ICRC has also very much shifted to direct assistance of the civilians affected by conflict.
Right.
It can be they're displaced, it can be they indeed are injured, and it goes all the way to very tragic situations, looking at the Middle East today, where hospitals who are protected under international humanitarian law, who for all of us represent really the place where never ever anybody should want to drop a bomb or explode himself inside such a structure, have become deliberate targets. So the ICC would very much like to see a world where its services would be less required, but unfortunately this is currently not the case.
All right, very interesting conversation, I think, Reto. There's a lot more to discuss on these issues, on how you help and on different, what are the different venues and arenas where you work and help the civilians. We are in conversation with Reto Stocker, the head of delegation of the International Committee of the Red Cross in Pakistan. We'll be back after a short break. Stay with us.
"150 years of service to humanity by International Committee of the Red Cross could not have been possible without the passion to serve unconditionally." These 15 decades since February of 1863 are marked with independence, impartiality, and neutrality, adhering to the Geneva Conventions. A Memory of Solferino was not just a book by Henri Dunant, but it was the scripture that carried the theme and the plan that the nations of the world should form relief societies to provide care for the wartime wounded. And this finally became the foundation on which ICRC was established. Going down the memory lane in times of pain, grief, and dark ages of sufferance in different parts of the world, ICRC's undaunted efforts to ensure respect, dignity, and integrity for the unfortunate has been ongoing. The emblem of ICRC was actually the sign of hope in despair. Years have gone by, means have changed, but the passion for service to humanity remains unaltered. In 1947, right at the time of the birth of Pakistan, father of the nation, Muhammad Ali Jinnah, chose the ICRC as the neutral intermediary to address humanitarian crises following partition between India and Pakistan. In February 1949, ICRC opened its first office in Lahore, Pakistan. At difficult times of refugee crisis, wars, natural disasters, and the contemporary aftermaths of armed violence in Pakistan, ICRC's presence has increased and its relationship has deepened with Pakistanis. War is marked by losses, and ICRC is marked by gains of trust, health, and happiness for the people to their way back home. During and after the wars of 1965 and 1971, the ICRC supervised the release and exchange of prisoners of wars and civilian interns, especially the wounded. Exchange of letters and parcels and links between families on either side of the border, and provision of food were the honorable responsibilities fulfilled by this committee. In the 1980s, the focus was on the Afghanistan conflict that spilled over into Pakistan. The ICRC established hospitals in Peshawar and Quetta to treat weapon wounded. It continued its dedicated support until humanitarian needs demanded. An orthopedic workshop in Peshawar providing assistance to amputees has been serving to its full capacity. ICRC has promoted international humanitarian law and brought about happiness for people from all corners with all fairness. Humanitarian services have always been extended to all needy people without discrimination. Whenever Pakistan faced hard times like earthquakes and floods, help for children, women, and men came from the commitment of the ICRC that stood side by side, working endlessly to relieve people from their physical pain and provide them better living conditions. All aspects for improved living have been a focus of the committee. Medical assistance, temporary shelter, water treatment plants, strengthening of the local livestock are worthy achievements of ICRC. Establishment of Muzaffarabad Physical Rehabilitation Center that provides artificial limbs, crutches, walkers, wheelchairs, and user training speaks volumes of the hard work and dedication of members of ICRC working in Pakistan. Economic security can come if essential needs can be met and maintained to restore sustainable livelihoods. ICRC's programs for sustainable food production and microeconomic initiatives have helped Pakistanis in disaster and violence-hit areas in Khyber Pakhtunkhwa to rebuild their lives. In such difficult times, the ICRC made an all-out effort to give what was needed the most. Shelter kits were distributed among people affected by natural disasters at different intervals. Restoration of family links, food for survival, clean water to drink, and help to start life afresh was extended by ICRC. Only in 2010, together with Pakistan Red Crescent Society, the ICRC provided food, water, and medical services for over 1.4 million people, in addition to raising awareness about risks of mines and unexploded ordnance. Monsoon floods caused destruction in Pakistan, particularly in 2010 and 2011. The ICRC again reached out to people through a donation of assistance of goods to its Red Cross and Red Crescent partners. Health issues in Sindh have been addressed by healthcare initiatives. Pakistanis from Pakistan-administered Kashmir to Sindh bear witness to the work of the ICRC for the people of Pakistan. mobility for the immobile, dreams for the young, life for the hurt, all under the umbrella of ICRC, whereby life does not come to a still even without legs. Under the sky, all are equal for the members of the International Committee of the Red Cross. This emblem points at all directions for service to humanity. These were memories of 150 years, which promised a future of service and trust till eternity.
Welcome back. You're watching Diplomatic Enclave, and I'm in conversation with Mr. Reto Stocker, the head of the delegation of the International Committee of the Red Cross in Pakistan. Reto, before the break, we were talking about the different activities in Pakistan and across the globe. But since when are you in Pakistan? This is a question I never asked you.
This time I came 3 years ago, and I'm working as the head of delegation of the ICRC in the country. My first stint was of very short nature, early 1999.
That you said in the very beginning, yes. And then you came back in 2005.
2005, my wife and I actually had planned to go hiking up north, and she was at the time heading an organization and was extremely busy with a massive response to the earthquake. I was technically on holidays, but offered my services to the ICRC and ended up actually doing the coordination for the first 3 months. What became a very big relief operation, the ICRC. We used to call it the 150, which meant at that time $150 million budget for the first year, 150 mobile staff workforce, and 1,500 resident staff, most of them recruited, in a hurry on the ground in Kashmir. We flew, I think, at the height of our response capacity, 12 helicopters, had an excellent understanding with the biggest actor at the time on the ground, which was the Pakistani military, in terms of a complementarity of what we were doing, be it thematic, certain aspects done by the ICRC, WFP in the military, or indeed also geographical. We had a very strong response in the Neelam Valley, and I saw firsthand, of course, an enormous misery across the area. And I saw firsthand something that impresses me until today, which is an enormous indigenous capacity to, with heart but also technical expertise and an enormous commitment, come to the aid of those who are suffering. I'll never forget the convoys of people coming from down country, not just Islamabad, but in entire Punjab, some even coming from Karachi with their trucks full of water bottles and kind of tents collected somewhere, food, obviously financial donations. We had set up a hospital with 150 beds in the Muzaffarabad cricket stadium, which hadn't been finished, so was already nicely leveled and indeed allowed to set up within the first week a massive hospital. But that was really just one aspect of a multifaceted response, which really brought out the best of Pakistan first and foremost. It is there where I learned, kind of to appreciate the motivation of the staff members of the Pakistan Red Crescent, but also philanthropists, the diaspora coming back from, the furthest corner of the globe, just to be there for 2, 3, 4 weeks, very often bringing their own finances, working day and night. And I think this aspect of Pakistan is the one that continues fascinating me, and also showing the institution as a whole that, the times, here particularly referring to the 80s, where the ICRC needed to come, open surgical hospitals, have its own surgeons, and sometimes even, expatriate nurses, they're really gone. We tend to forget that Pakistan exports today, if I'm not mistaken, between 4,000 and 5,000 doctors globally to the world. Highly skilled, highly motivated. So an ICRC that tries to sell a capacity doing surgery and direct implementation, frankly, for a country like Pakistan, is not very interesting. I think that has also led, you were before asking on how do we interact with that national capacity and commitment. Just in this domain, we have shifted completely. We used to run hospitals in the 80s and 90s. Indeed, kind of probably saving 10,000s of lives, predominantly Afghans treated in those hospitals in Peshawar and Quetta. Over the last 2 years alone, we, however, have shifted this idea from bringing surgeons in who operate themselves to having specialists coming in, highly skilled in what is called weapon wound surgery, which is a very specific technical expertise. You learn to deal with dirty wounds of blasts, for example, extremely complicated. And they teach these skills. We last week, for example, at ISRA had a 5 days a training course for young surgeons, accredited, 30 credit hours, interesting for doctors. And these doctors from all over the country, after those 5 days, going back to their respective hospitals, some in provincial capitals, but others out in far-flung areas. We always have a good mixture of both civilian and military surgeons in those trainings, and again, manage to really increase the scale of our operations in an approach of imparting training on those who can make the difference. And I think that is really an ICRC that makes sense. And I could give you other examples where we have chosen the same approach, and I think today with less, including in terms of financial resources, managed to do more.
When you say doing more with less finances, what other activities do you undertake in Pakistan, apart from, of course, helping out those people in need in the 2005 earthquake, for example, and other areas, and of course training the doctors, as you said, in how to treat wounds that are surgical in nature or following blasts? What other avenues do you work in Pakistan?
Still closely related to that, because we are who we are, we know what we're good at, we also hopefully know what we're not so good at, but we have a long history globally actually of helping people with physical disabilities.
All right.
It started out on a very conservative interpretation of who is allowed to get ICRC treatment and who isn't, to the extent that back in the early 80s, in those same kind of very hospital cities of Peshawar and Quetta, towards those millions of Afghans who thought shelter, who thought security, who sought assistance. So we had what the ICRC calls physical rehabilitation centers, a highly, again, technical domain where artificial limbs, predominantly legs, below knee, above knee, are being fitted. Again, back in the 80s, a lot of ICRC staff being imported doing this. Fast forward to today, we have a very small team in the ICRC, and we work with renowned organizations, some of them with a long tradition in working in physical rehabilitation, and others that we have specifically brought into this domain. I tell you one story. We felt that it was indeed not fair to essentially look for those patients who unfortunately kind of blew up on a mine, and telling others who lost a leg because of diabetes or because of a car accident, sorry, it's not for you.
You don't differentiate between them. As long as there's a disability, you treat them and you take them under your care.
That is how we have changed the interpretation of our mandate, because I think ethically it's just not defendable to have that very kind of narrow angle. And we also felt that geographically we needed to change. The investment has gone for the better part of 3 decades into KP and FATA, where the response capacity is big. And we felt a city like Karachi with 20 million inhabitants should indeed also have a center that provides high quality but free of charge treatment. And it is in a place like Karachi where, again, we were confronted with the best that Pakistani society as a whole can deliver. We 2 years ago started collaborating with Indus Hospital, Professor Bari Khan, who has this commitment to excellent quality but free of charge medical care for everybody. He started out with a small hospital, and up in a realization, including of provincial governments, that governments are not always excellent in providing health care at the tertiary level. There's more and more public-private partnerships. So Indus is indeed on a bit of a roll, setting up hospitals in ever more places. And the knowledge about how to Pindi and Sargodha will indeed finally bring relief to what very often are the poorest of the poor.
All right, Reto, there's something that which is very good, which is heartening to know, that you've been very aggressive as far as your strategy in Pakistan is concerned. recent strategy. Why is there a difference? I mean, has the strategy of the ICRC for Pakistan changed in the last decade or so, as far as working more aggressively or working in different sectors is concerned?
Yes, I think we have changed our strategy. We need to be a learning organization. I also see, let me start differently. The ICRC currently has almost 70% of its global budget of, it's about $1.8 billion a year, going into the Muslim world. The Muslim world is in turmoil, the Middle East in particular, but also kind of parts of Northern Africa, the Maghreb, places like the Central African Republic really see a lot of violence increasingly affecting Muslims. Pakistan, for the ICRC, is a Muslim country with a very strong religious tradition where we can learn what are relevant response mechanisms, partnerships that do make sense in a Muslim setting, that has elements such as zakat, that compared to where I'm coming from, has a philanthropy that is extremely strong. You have a good idea, you have a charismatic leader, you have accountability, and money very often is not
All
the
right, that's
problem.
very interesting to note, and I think there's a lot more in that field that we're going to talk about, but after a short break, stay with us. And we're still in conversation with Reto Stocker, the head of delegation of the ICRC in Pakistan. Reto, we were talking about the different issues that confront the Muslim world, particularly in the Middle East, and how the ICRC is helping them out in different contexts. So we kind of went to a break, and I would like you to continue with that conversation.
If you look at the situation in Syria today, the ICC, of course, works in a traditional modus operandi. It tries to, for example, get the agreement of varying parties to the conflict for humanitarian ceasefire agreements, allowing it to have convoys going into areas that have been cut off from even the most basic of services, including water. So that's, a very traditional ICRC on the ground. That is not the situation that the ICC is confronted with in Pakistan, where the response capacity that is required indeed is in many organizations, governmental bodies. The NDMA, for example, over the last 10 years has evolved enormously, and nowadays is really kind of a key coordinator of a national response in catastrophes. So I think the developments in Pakistan have helped the ICRC to, specifically for the Muslim world, also see how it can change its modus operandi, how it can make better use of its very specific skills that we have, of the mandate which is particular, and we would not want to give that up. That is who we are genetically. But I think in order to really get the best possible response, interesting partnerships help enormously. If you look at the capacity of working together with, I mentioned Indus Hospital before, but let me also mention IDISAB, the IDI Foundation. It's so many people who are extremely dedicated to doing things right, and they might just come to you and say, we have a technical issue on, for example, dealing with mortal remains. So we can bring experts from outside of the country that do a teaching session, have done that repeatedly. Nowadays, we even go a step further. We, for example, as I speak, have a 5 days workshop running on management of the dead in emergencies. Again, the cultural sensitivities on the dead in a Muslim context are extremely important. Time is of essence. Dignity is extremely important. And Pakistan has developed a lot of best practice in its obviously unfortunate having to deal with so many events of mass casualties, be it man-made, be it natural disasters. We talked about Kashmir before. So as opposed to an old ICRC that would try to be with its hands on literally in such situations, we have moved to an ICRC imparting training, and in the case of Pakistan, to an ICRC actually using the capacity of Pakistan to show it to other countries. At that very conference, we have representatives and very much the best of the best in the forensic field from 16 different countries attending, exchanging experience and having mostly Pakistani specialists intervening on different aspects contemplated by the ICRC, who also brings its own experience. And I think those are, again, models which are interesting, where the ICRC is a learning organization and really finds a niche where, with very specific interventions, it managed to have a huge impact. And personally, I must say, it is also nice if, that kind of response capacity of Pakistan can be globally, because we all know that Pakistan too often is in negative headlines, and there is so much that is happening in the country which is extremely positive. Another, I would say, relatively new aspect of partnerships is indeed also with academia. We tend to think that we know, but we don't challenge ourselves sufficiently. You start working with a social science department of a university and suddenly feel, oh, we're being questioned here, and things are maybe not exactly the way that we learned they are from an African context, but they are actually quite different here. So I think, again, this partnership, working together with Aga Khan University in Karachi, JPMC, Dow University, and others, suddenly gives us an access to hardcore science. A capacity to get an understanding of what is happening on the ground. We qualitatively, for example, managed to analyze in what form, how frequently, and how seriously are various aspects of violence affecting healthcare in Karachi. The headlines from the media would tell us it's doctors that are being killed, often on sectarian grounds, and that's really the image that was projected. Looking with statistically sound methodology and partners who have their feet on the ground and their heart on the cause into what are actually the prevalent problems in terms of healthcare being challenged, people not having access to healthcare providers facing insecurity, we realized that the bigger problems lie elsewhere. The study, with more than 1,000 interviews that was conducted, showed, for example, that the most vulnerable in the whole chain of healthcare provision, are ambulance drivers, facing enormous violence, some of it based on the sheer fact that there are misperceptions, that families think that, that poor ambulance driver can perform a miracle, and he obviously can't. But then there is also physical violence, where we were dealing with a lot of ambulance drivers telling us that they were shot at while trying to go into an area where, they didn't have the right emblem on their ambulance. So we found in Karachi, all the way from government, city administration, the rangers, the police, then the whole medical fraternity, from hospitals all the way to lady healthcare workers, the different ambulance services, ED, Aman Foundation, CHIPA, the Pakistan Red Crescent. We really found a community that was extremely concerned with an issue, but had so far not really managed to come together and jointly analyze what are the issues and put their hands together to try and find solutions. And I think, again, that's where an ICRC with relatively limited resources, but a good understanding on those issues, a credibility, also a standing as a neutral organization, can make the difference. And I'm happily reporting today that a campaign using media very effectively actually has led to a 17% improvement in the acceptance of ambulances passing and people having to move their cars aside. Now, you look at this over the year in terms of how many lives it saves, and you suddenly have the impression, okay, it might not be so visible when you hold that workshop or that conference or you analyze this issue or another, but doing it for a whole city with all the stakeholders involved, you have a big impact. And you also affect mindset of people, and I think that's very interesting.
I mean, the impact is very important on whatever part of the society, whether it be campaigns like those on the ambulances and the respect of ambulances and the violence against healthcare workers, or all the other programs that you're working on. The impact is very important, long-term impact more than a short-term impact, because people need to understand what the reasons are and what you're trying to explain to them, whether through workshops or other campaigns, and they need to inculcate it in their personality and in their daily life so that they kind of make that change in the longer run. But you said you work with limited resources. When we talk of limited resources, who are your partners or donors that your organization normally works with?
The donors include the state of Pakistan. It's actually all the signatory countries to the Geneva Conventions. So the body of law defining how military forces have to conduct their operations, called international humanitarian law. All the signatories, which is 189, so each and every country in existence on the globe today, they all contribute to the operational budget of the ICRC, some more significantly, some less significantly, but the bulk of our donations still come from countries and states paying for the operations of the ICRC.
All right. You've got these different campaigns in Pakistan. You talked about all the different issues that the ICRC is involved in Pakistan. What do you see coming up next? I mean, because as you said during the show as well, the ICRC is constantly evolving and changing and updating itself. What do you see in the next 10 years in Pakistan? What kind of campaigns or issues would you like to address?
I think we would continue to be very interested to see a strong national response capacity to the kind of emergency situations which will continue to occur. You know, the floods will not go away. Global climate change will affect Pakistan, unfortunately, probably more so than, you know, European countries. You are already in a precarious situation with either too much or not enough water. So I think that the environmental catastrophes all the way to the earthquakes will probably continue, and while there is a growing middle class in Pakistan that can also be, as you said, educated, mobilized to be part of a response capacity, you will continue to have a large segment of the population that is relatively poor and very, very rapidly get to its very limits when faced with such catastrophes. But again, I think providing skills and empowering a national response capacity is really where the future of the ICRC lies. And I think we have to go all the way to saying, if we're no longer needed, isn't that beautiful? We are not there. I think there are many domains where we clearly feel that what we are contributing is actually appreciated. We are, and that is also something that I find beautiful in Pakistan. You do a workshop here. You have people coming ahead of time from all over the country, are interested, are contributing, are critical, don't constantly watch the time or fall asleep, but don't even realize that lunchtime has come, and you feel you're providing something which is appreciated, which is going in. Look at the 35 doctors that we had at ISRA last week. Not only did we assess their starting capacity to be at 63%, so we did an assessment before the workshop on specific technical issues. They were average at 63%, but that 63% at the end of the 5 days training actually had gone up to 89.
All right.
No, for this type of workshop, this is exceptional, both in terms of initial understanding and also the learning curve. And I think that is, again, a side of Pakistan which is not shown sufficiently.
All right. Well, it's very interesting to note because there are different sides to Pakistan. A lot of sides are not shown, as you said, internationally, and we've got that negative image that is portrayed all over the world. And it is through organizations such as yours that send their reports as to how people are responding and how the change is coming in the country, that sends that positive image across the world globally, because being a global organization, you transfer it to the whole humanity, to all the people around the world, that how a country like Pakistan is changing and how it is confronting the challenges that you are helping it with, along with the government and the other organizations that you're working along with. Reto, thank you so very much to have joined us, to have informed us, and in such a dynamic and charismatic manner that even I, felt like an audience member and just listening to you and kind of trying to absorb as much information as I could. And I think there's a lot more that the ICRC is doing in Pakistan, and we need to encourage such endeavors. And we, even as people, myself as an anchor or the people of the society, need to work together along with organizations such as yours so that we prepare a healthy society for the generations to come, a society that kind of understands the general values and concerns that all the other people are related to and need to for their betterment and for their sustainability. Thank you very much, Reto. Ladies and gentlemen, a very healthy, a very I would say a very short conversation with Reto. We could have gone on for an hour or so, but unfortunately our time is limited. Organizations such as the ICRC are very important, not only for societies and countries such as Pakistan, but also for other countries that are conflict-ridden or have other issues, such as Congo, such as Liberia, such as the Middle East, and other countries where the ICRC is working. It is now up to us as people, as societies, to work with such organizations and to build stronger nations, stronger countries, and a stronger world. Umar Khalid Bhatt bids you farewell from this episode of Diplomatic Enclave. We'll be back next week, same time, same channel. Till then.